the fact that Ford complimented Trudeau and Trudeau complimented Ford is a sign the apocalypse is on us.
Welcome back to Poutine Politics, Canadian issues served with cheese curds. My name's Adam.
My name's Remotely Mike.
Remotely Mike. How are you doing, Remotely Mike?
I am barricaded in my house.
Perfect. Have you got steel bars keeping your front door closed?
No, I haven't welded them yet.
Okay. No soldiers at the front door making sure you don't come outside or anything like that?
Nope.
Okay. Well, you're doing all right then. Obviously, if you can't tell from the sound of this recording, we're not in the same room anymore. Not right now.
Nope. That's why Adam's voice is clear, like it usually is, and my voice is slightly worse, which isn't good for anyone.
For the time being. Well, we're going to sort that out. The first thing I wanted to start with, obviously, because of this whole situation going the way that it's been going and the social distancing thing and whatever, is I wanted to start with a little bit of follow-up from our episode about COVID-19, because obviously when we recorded that and we released it, things were not going quite as crazy as they are now. I think, if I'm not mistaken, the day that we released that episode was the day that Italy went on lockdown.
Yeah, that sounds about right.
I think that was the day that the whole country of Italy went on lockdown, as opposed to that northern province that was on lockdown already. So, when that happened, when I heard the fact that Italy was locking down, I'm like, I feel like we're almost going to sound a little insensitive, but at the same time, and you know what? Talking to a couple of people, they're like, you were kind of a little too lighthearted on it, and I'm like, yeah, okay, I get that, but that wasn't the point of our message, because we still did talk about certain things like washing your hands and don't touch your face and stuff like that. But I wanted to reiterate your comments about the media.
Yeah. My comments about the media, and the media's changed their focus too, right? When we first started talking about this, they were over dramatizing it. They didn't bring any solutions. So if the media was saying, hey, listen, this is a problem, we need to flatten the curve, for instance, which they've been doing a fantastic job since, and drop the sensationalism, and props to them all for doing that. But if they were always talking about that kind of a thing with a non-hysterical atmosphere, it would have been that much better. But that's not how they were talking about it. They were talking about it like doomsday is coming and we're all going to die.
Right.
But that's not what's happening now.
No.
We just have to stay away from each other and wash your hands. The only difference from the message that we gave the last time was wash your hands still. Okay, you got that. And just don't spend time with, don't go out into big gatherings and things like that, and practice social distancing.
Yeah. Right now, what is it? In Ontario right now, you're technically, it's gatherings no larger than 50, right?
Yeah.
Which then I guess apparently was it the CDC in the States where they're saying that it should be no gatherings larger than 10 for the next 8 weeks or something like that? I don't know.
That might be because they don't test in the States.
Well, yeah, that could be.
So they need to lock it down as much as possible. But the reality is that, if you see even famous YouTubers like Kyrgyzstan has a fantastic video on this.
Yeah. Yep.
Mark Rober released a video on it. And these guys are saying the same things, and the same thing that all media is releasing too, which is great to see. And they're not trying to scare anybody. They're not releasing this video saying, hey, you're all going to get this. They're saying solutions. And when I was referring to the media before, I was talking about them hyping up the problem.
Yep.
And that was my big issue. Did I minimize it? Yeah, because I was sick and tired of hearing how big in the other way was. I was trying to move what they say the Overton window was.
I think that's what our comments about the media was really about, was the fact that it was almost an over sensationalization of it. Yeah, obviously it's a serious situation, but they're focusing on it the right way now, not going too overboard. From what I've noticed, I feel, mind you, since we recorded that episode, I'm not paying as much attention to the media as I am to either public health officials or others.
The media that I've seen has been much better. Yeah. Much, much better, right? The articles that I've seen and come into my sphere that I tried to avoid, they're much more, this is what you should do, this is why you should do it, And don't worry, don't panic. Everybody will be fine. We don't know how long it's going to be. And they're not trying to answer things that they don't know with partisan rhetoric or anything like that. They're just saying, we don't know this, but this is what we do know. This is what you can do to best mitigate it. And it's great. It's fantastic. I would love to see media do this every day. That's why I always had such issues with them reporting about catastrophic failures, right? There's a lot we don't know about COVID-19, but it's not going to be as deadly as long as we practice as some of the other things that are as deadly.
Yeah.
So.
Yeah, I guess. I mean, you know what? It's going to depend on. It's going to depend on the society and the location and stuff like that too, right? Like obviously from a percentage, like the mortality rate in Italy is really high right now, but there's plenty of reasons for that, right? Like again, they didn't lock down early enough. They didn't really take it too seriously either from the get-go. Still a lot of, public gatherings, people going out, and it's a lot of European cultures are very touchy-feely, as it were, like a lot of hugs, kiss on the cheeks, stuff like that, and very social. I would say they're definitely more social than we are in North America. And at the same time, then they also have issues where, you've got multiple generations living in the same house. And when that includes elderly people who are more susceptible to this in the grand scheme of things than, say, we might be at our age, there's going to be an issue.
Yeah, and they have multi-generations living in their house. That's another problem, too, where they'll have, like, the son, the daughter, or the son, the father, and the grandfather all living in the same house.
Yeah.
So one person gets it, and then now you've got every one of those spheres now all of a sudden have it too, right? And we're not talking about a son who's 5. We're talking about a son who's like 22.
Yeah, exactly. Yep.
Who can get out more because their youth unemployment rate was like 25 to 30%.
Yeah, something like that.
Yeah, it was really high. So it caused more problems. Not saying that it can't occur in our neck of the woods in Canada, but again, media is doing a good job. Thankfully, I'm very happy to see that. Our government's doing a good job. Again, when I made the comment 2 weeks ago about Ford, he's so calm, collected, not angry at the media. It's weird.
Yeah.
Great.
Yeah. Like we've generally had some negative things to say about Doug Ford, but he's kind of stepping up right now.
Yeah, it's fantastic to see.
Jason Kenney, on the other hand, is still a douche.
Well, man, like when we're saying that Trudeau and Ford are leading the charge and Kenney's the one falling behind, it's like, what? If you had told me 6 months ago that this would have been to happen, I would have laughed in your face.
Yeah.
But Ford's doing the right thing. Like he's complimenting the media that he has like just railed against for years, threatened to sue them and everything.
Well, I think
that one person that nasty word, and like same media, and now he's like, no, they're doing a good job.
Yeah. Well, imagine the number of people that fell out of their chairs when he said that the Toronto Star is doing a good job right now.
Right? Wow.
When has a Ford ever complimented the Toronto Star?
Exactly.
So I mean, like maybe our opinion has changed, but that's also because the narrative's changed, right?
Yeah, like I'll say, my opinion on the media has. I like to give people props where props are due. So Ford's done a very good job. Trudeau's done a very good job. The media's done a great job. And before, they've been failing me. So I like to give them props. And generally speaking, my attitude is now I know that I need to social distance. That's changed. But still washing your hands and we're good. Yep. So yeah, that's the opinion that's changed, is that now I know that social distancing is the thing that doctors recommend. Yeah. Okay, I'm going to do that because doctors recommend it.
Yeah, exactly. Exactly.
Not lock myself in the house and hoard toilet paper. Nobody's recommending that.
Well, I mean,
and I'm so glad Costco and Walmart aren't taking that back.
Oh, yeah. When I saw that was great.
It's like suckers.
And it's, I mean, what is it? Like 500,000 people applied for EI last week, whereas I think in the same week last year there was only 27,000 applications for EI. And it's like, well, okay, under the circumstances, this is to be expected. People are going to at least temporarily lose their jobs, right? Mm-hmm. Now, I guess on the same token, so I did see a little bit of news today, and apparently Walmart is looking to hire 10,000 people for stores and distribution.
Yeah, I saw that. I saw that there's been posts for things like that, and in my industry, which I got laid off.
Right.
I'm a little bit different, though. I know that if I want to get someone else, I probably could get another job quickly. But still, for a lot of people I work with, they're the ones that are going to suffer the most. And I definitely be encouraging them to get jobs in those like cleaning jobs or cashiering jobs at various locations like Walmart and Costco and things like that, even temporary, because once the temporary necessity is gone, your job will be back.
Yeah. Yep. And you know what? I mean, some people might find that the change in job is better for them, is possibly an opportunity. And at the same time, I mean, you know what? I mean, if you take one of these jobs that are available, you might get paid more doing that than sitting on EI. I mean, yeah, you put yourself a little bit more at risk because you're out, you're in a store, you're kind of in the public, you're relying on other people to be healthy just as much as you're, relying on yourself to be healthy. But, it's got to be done.
Some people you have to work, right? Like they can't survive on EI's 55%.
That's me. I need to work because it's just work is part of my routine now. All right. So what I wanted to talk about was, well, I guess technically it's the second economic package that the federal government's put together, because the first one that they did was the $10 billion package that they announced a week and a half ago, something like that. But then there's the big one. There's the $82 billion economic stimulus package that was introduced this week.
Oh, okay.
And it was introduced.
We're ahead of the curve.
Yeah, well,
that's a first.
Maybe. Okay.
Nobody else is bringing us down.
No. I mean, okay. So
that's what I mean with we're ahead of the curve. No one else is doing this. Like everyone else is worrying about. Everyone else in the media is worrying about like how COVID, how long it will be, and all this kind of stuff. I'm like, I'm not an expert. I don't know. I don't care.
Yeah.
Like I can't. I shouldn't say I don't care. It's not going to be a thing to worry about for me. I'm going to worry about what I need to do to make sure I don't spread the disease and how I can be in better shape when the disease is done.
Well, and I guess the good thing about this plan is that it does provide money to individuals. Whereas, let's say as a comparison, the first big thing that came out in the States was the Federal Reserve providing money essentially for the stock market, $1.5 trillion in loans and stuff like that for the stock market, because they were more concerned about the fact that the stock market was crashing as opposed to the fact that the number of people getting sick was going up.
Yeah, is that surprising to you under that system?
No.
They fired the emergency people for a response like this.
Yeah, I know. Last year or 2018 or whenever it was. It was at least a year ago that they fired those people. Hey, look, probably would have been a good idea to have them around right now. Yeah,
just because the guy who's in charge of it outsources to Facebook to see how to deal with it. That's not a big deal, is it?
No, not really. Yeah. $82 billion. Part of the issue, I go onto the government website like Canada.ca, and I don't know. There's a lot of generalities, I think, on theirs, with their information. It talks about like the large dollar amounts. I'm kind of like, I want to know what the smaller dollar amounts are going to look like. So I ended up finding a bit more information on BDO's website. So BDO's a big accounting auditing firm across the country. Some of the things that were introduced, let's say for individuals. The first thing we have here is what's called the emergency care benefit, which will provide up to $900 every 2 weeks for up to 15 weeks. Maybe that's going to be long enough. Maybe it won't. So this is through the CRA, support people who do not otherwise qualify for EI. And so it's designed to support workers and self-employed people who are quarantined or sick, workers who are taking care of a family member, or parents with children who require care because of school closures. So $900 every 2 weeks, $450 a week, 15 weeks. Doesn't start until April of 2020. Or the applications will be available in April of 2020.
A lot of stuff, it's unfortunately trial by fire.
Yeah.
Like they're trying to scramble. They don't know what they can or can't do, so they're trying to get it done as quickly as possible. I got to give them a little bit of slack if they make mistakes.
Oh yeah, and let me preface all of this by saying a solution is good. It doesn't have to be perfect in this situation. It just has to be something. Now, the only thing I'm going to say probably about this stuff is that a lot of the money that I'm going to be talking about here is not really going to end up in people's pockets or bank accounts until May. So that's the potential downside, is that while people are going to get extra money from the government, they're still going to be waiting about 2 months for that. So hopefully either A, they're still working, or B, they're on EI and the EI does cover what they need to cover. Like obviously, in Ontario now they're not going to process evictions. Doesn't mean that you can't be evicted technically. It just means that the evictions won't get processed, so you won't get kicked out of your house. But your landlord can still, prepare the eviction notice and such. So you're probably still going to be in a position where you have to pay your rent. Okay. So hopefully if you have lost your job, you can still afford, those certain bills that you need to pay, because there's certain things that you're still, as much as possible, you're going to be expected to pay them. Okay.
The other thing too is that I don't know, like the expectation is you're supposed to still pay the bills. Still, like just because you're getting a reprieve doesn't mean that those bills still won't accumulate. Right. So where possible, you should be paying them.
Yep.
If you can.
Okay, so then what do we got? Let's see some of the other stuff that has been introduced here. So not needing to provide a medical certificate to access EI sickness benefits, so that's good, especially for people that don't have paid sick leave. So the idea is that you're not having to provide like a doctor's note or something like that. Let's say if you've been quarantined because of COVID-19. The doctor's note thing is such a waste of time anyways.
Doctor's notes in general are a waste of time. Like if I'm sick for a day or two, I shouldn't have to go get a doctor's note to do that.
Yeah.
And it's simply because I know whether or not I'm well enough to come into work. I shouldn't have to get a doctor's note and clog up the system just to be like, have the doctor tell me, yeah, you're sick. You know you're sick. Yep. Why are you here? We can't do anything for you in a day.
Yeah. I remember almost 10 years ago now, I took a summer off of work for medical reasons, and it wasn't like a physical ailment or having like a sickness or anything like that. Like it was mental health in my case. Okay. And so I go to my doctor and I'm like, well, in order for me to take sick leave, I'm probably going to need a doctor's note. And I go to my family doctor and I explain the situation to him, and he's like, well, I don't know what the note's going to do for you, but I guess I'll do one up for you. And I'm like, okay, well, I mean, at least it's something. But yeah, I'm taking that, whatever, even if it's 15 minutes, I'm still taking that appointment from somebody else that might need it so that I could get a note.
Yeah.
Yeah.
I had a similar note too, so where it said like Mike is incapable of working for the foreseeable future. He'll be reevaluated at some point in time.
Yeah. So
and that was that.
That was it.
But I still had to get it.
Yeah, exactly. Still had to get the note. So some other things here. So if you qualify for the quarterly GST credit, then you're going to get a top up in May. So it'll double the maximum annual payment. So an individual will get up to an extra $400. Couples will get up to an extra $600. And then also increasing the maximum annual Canada Child Benefit payment, which could be up to an extra $300 per child in your May payment as well. There's going to be interest deferral interest-free moratorium. So interest-free for 6 months on student loans, reducing the minimum withdrawal requirements for RIFs for people who are retired by 25%. So normally, once you have converted your RSPs to a RIF, depending on your age, there's a minimum percentage of the value of what's in there that you have to withdraw on with every year. And the idea there is obviously because the pandemic is also coupled in with, a global financial meltdown, that by reducing what people are required to take out of their RIFs will hopefully protect a little bit more of that money for when things get cleared up and the stock market starts to recover, people's investments start to recover. Any comments on any of those things?
No, it's one of those things where they are very much Band-Aid solutions, but they're necessary Band-Aids.
Yeah. Yep.
Right?
Okay.
Like they're temporary, but they have sometimes you have a cut. You have to cut it with a Band-Aid. It's not perfect, but it does work.
Yep. So then there's one other thing here. And again, to me, this is one of those like you don't necessarily think about this in this whole situation of, say, being self-isolated at home or this social distancing where you're staying at home. And like I saw an article, I guess it was earlier this week, about the fact that domestic violence cases might increase during this period of time.
I can see that.
Yeah, so
if you don't really like the person you're with.
Yeah, possibly. One of the things that's in this funding as well is supporting women and children fleeing violence by providing up to $50 million to women's shelters and sexual assault centers, including facilities in Indigenous communities. So, might happen. It's possible, especially if you're already in, if you're already in a situation where there is some abuse already happening.
You're just asking for escalation. When you put people that are in a troubled relationship in close quarters for a consistent long basis, it doesn't make for a nice situation. I mean, there's plenty of studies about people being trapped for prolonged periods and how they interact and how sometimes it goes well, sometimes it goes poorly in a big hurry. There's also people are posting things about how in January next year there'll be a baby boom and we'll call them the quarantines.
Yeah. Okay.
For the exact same reason.
I mean, okay. I mean, I get that that's probably going to happen, but let's say worst case scenario, we're still holed up in our houses 9 months from now. And there's still, like, the healthcare industry is still, like, extremely stressed because people just haven't been doing what they've been told. Could you then imagine that on top of the fact that there's still, like, say, hundreds of people every day getting treated for COVID-19, that now there's all these people that are coming into the hospital because it's like, oh, by the way, we're having a baby.
Listen, the reason why we have a drop in, I've said this for a while, the reason why there's been a drop in teen pregnancy isn't because somehow they're getting the message better or somehow they're practicing safer sex or anything like that. It's just because they're not as bored.
Yeah.
Right?
Yeah, it could be.
Right? Like it's I think it's that simple.
Yeah.
Right? Like if I grew up in the country and you find, if you can't find something to do, you're going to find something to do. And sometimes it's, getting into mischief and sometimes it's getting into other kinds of mischief. Whereas now you can just be like, oh, I'm just going to go on my Xbox. I'm just going to go on my Switch, whatever. And play with my friends.
Yeah, exactly.
Now you can see them. So, yeah.
It was a meme that I saw yesterday. It was 2019 was get off your phone and go outside, and 2020 is get on your phone and stay inside.
Right. I'm going to get my bikes out because I'm going to start riding my bike soon.
Yeah.
But, other than that, I'm not getting out.
Yeah.
I've gone out. I've gone out. Like, it's not like I've been completely sheltered, so.
Yeah. I'll go for walks or something.
Yeah.
But just
stay. All about minimizing.
Yeah, that's right.
So let's say you're a family that used to eat out 5 days a week and you only eat out now once a week. That's still an improvement. And getting back to the other thing, you don't have to completely change your lifestyle. Just change it a bit.
Yeah.
Anything is progress.
Yeah.
Right?
Yep. Oh, yeah. I think, I mean, that was like another thing I heard with all this situation is, restaurants are staying open right now, but when this is all over, either restaurants are going to have a huge windfall for at least a short period of time when people are like, oh, we can go outside again and we can go back to restaurants and we can hang out with our friends, or the reverse is going to happen, and it's going to be like all these people have started cooking at home more and realizing that A, it's cheaper, B, it's not as hard as it seems, and maybe they don't go out as often anymore, and restaurants still kind of have a bit of a decline in revenue. Yeah. It might be somewhere in the middle, but.
Yeah, I can see both happening. More and more people will start eating home, just like retail shopping will go down, will get hurt as a result for the same reasons. Oh, yeah. Like if you realize you don't have to go out, then maybe you won't.
Yeah.
Right.
Like, I mean, some people just go shopping because they have nothing else to do. And it doesn't mean they're necessarily buying something. They just go because they got to fill the time. I think fill the time with something else now.
Yeah. Yeah, it's an adventure for them.
That's right. That's right. Mortgage payment deferrals. through CMHC, so the Canada Mortgage and Housing Corporation. They're going to provide flexibility for homeowners where mortgage payments can be deferred up to 6 months. The only thing with that, though, is that because it's through CMHC, it means your mortgage has to be CMHC insured, which doesn't cover everybody, obviously, that's bought a house. Because if you've done at least the 20% down payment when you bought your house, or you're, a certain period of time through your mortgage, you may not be covered under CMHC insurance anymore, which means that you won't be able to defer your mortgage.
Yeah, I think I am. I don't know.
Well, you might be... See, this is the one thing I don't understand. I have never looked in with CMHC is... Let's say you have a 25-year mortgage, and when you buy the house, you only did a 5% down payment. So you have CMHC coverage at that time. But let's say after the first 5 years, you've paid enough principal that you've paid off the 20%, right? Where CMHC normally wouldn't apply. When you renew for your next term, are you still insured?
I don't know.
Yeah.
We're just going to pay it. We might be able to skip it, but it's not going to help us any.
Yeah. I'm really contemplating, maybe not the 6 months, but I wonder if I call them and say, let's defer it for 2 months or something like that, just to see how all of this goes and see how my work goes, right? As long as I keep working, then the mortgage can get paid. That's not a problem. But I'm just thinking, again, if things get serious enough that I have to get laid off, let's say, because I can't go see my clients, then yeah, I'm probably going to be looking to see if I can defer my mortgage.
Yeah, that's different. And that would be a different boat for you. Me, I'm okay, so I'm not going to defer.
Yeah.
Right. I recommend anyway, if you can make payments on things, you should, because unless you're very, very good with your money, postponing debt doesn't usually work out for your advantage.
No. Helping businesses keep their workers. So this is one of those ones where it's again, the government is providing money, but it might not be. It's probably not going to be enough to change an employer's mind between laying someone off or not. So it's a 10% wage subsidy for up to 3 months, maximum of $1,375 per employee and $25,000 per employer. So it helps. But as a comparative, I think it's Denmark and Germany are both providing a wage subsidy at this time as well. And I don't know if they're both the same, but at least Denmark's is 75%.
Yeah, I would like to see it higher. I don't mind that it's capped per employer, because quite frankly, if you've got more employees, you should be able to take more of a burden. If your margins are that small, you're probably not surviving anyway.
Right.
Whereas if you're a small business, taking a colossal hit like this can make or break you, even if you were doing well. Right.
Yep. Yeah. There's definitely going to be small businesses that are going to disappear because of this situation. Mm-hmm. It's going to happen.
Yeah.
Now, mind you, there's some big businesses that should probably disappear because of all of this as well. The problem is that the big businesses are the ones that are more likely to get the government bailouts.
Well, yeah, that's another story for another day.
That's another story. Ensuring farmers have access to credit, so just increasing access to credit through Farm Credit Canada. There's also going to be increased credit for businesses through the Business Development Bank of Canada and Export Development Canada. So that's just, ways for people to be able to borrow money, businesses to be able to borrow money. So now I guess the biggest part of the $82 billion, though, is the government announced the launch of an insured mortgage purchase program. So the government is, in order to add liquidity to the mortgage market, the government will purchase up to $50 billion of insured mortgage pools through the CMHC.
Oh, okay.
I guess the government is going to become a big owner of mortgages in this country.
Yeah, again, mortgages aren't like on loans, which a mortgage really isn't the best move necessarily, but time will tell. But this one's one of those things where, how much personal benefit will each individual get versus how much it will cost the government. And that one's hard to determine now.
Yeah. So then the last things I want to mention, and they tie into my line of work, although a lot of this stuff does, I guess. So the tax filing deadline has been extended for individuals. Yeah.
I heard that. I was like, yay, Adam, way to go.
I get more time. Yay. Although the more I get done now, the better, because I know there's people that'll be thinking like, well, I could just push off getting my taxes done. And I'll be like, don't do that. Don't push it off.
Get it done as quickly as possible.
That's right.
That way you get the returns as quickly as possible, because most people are going to get returns this year.
Yeah, especially if you are getting money back. So the deadline's extended to June 1st. If you owe the government money, you now have until August 31st to pay it off interest-free. So you get an extra 4 months there. I guess I should say the June 1st filing deadline is for individuals, really, because self-employed individuals have until June 15th anyways. So they'll have the extra 2 weeks on top of anybody else, where they usually have an extra 6 weeks. Now, the interesting thing, though, is that, well, and I understand it because it's different money, kind of, okay? So there's a deferral on income tax, but for businesses, there's not a deferral on payroll remittances. So for their employees, they're still expected to pay the payroll deductions every month by the 15th of the month. And GST, HST filings for businesses, there was nothing noted in there saying that there's an extension on filing those returns or paying your HST or GST, HST if you owe it to the government as a business owner. So you're still expected to file those things. So for me, those people that are now potentially thinking about deferring or waiting to get their taxes done into May, if they need to get their HST done for their business, then they're not going to be able to wait. I'm still going to have to see them at a regular time.
Deferring works from the standpoint in your particular business. It flattens your curve, so to speak.
Yeah.
If you're going to get some people that are going to want to push it back as late as possible. You're also going to get the people that no, I want to get done the normal terms because I don't want to mess everything up. And because there's those two individuals, you flatten your own curve.
Yep. Like it'll be interesting to see, right? Because I would still say pay your taxes off at the regular time, but I guess, for some businesses, because they're so cash flow reliant, that obviously if their cash flow has been hurt right now and into the foreseeable future, then yeah, they're going to need that extended time to pay their taxes in comparison to usual, right? Like there's some businesses or there's some people, I guess, where it's a lot easier for them to set the money aside to pay their taxes on time in comparison to other people. So I don't know. Of course, mind you, those people that don't pay their taxes on time, it just gives them another excuse not to pay their taxes on time.
Yeah. Like there's still always going to be some people. There's going to be, like I said, there's some people that are going to do it on time like they normally do it. And that would be somebody like, I'll say my mother would be very much like that.
Yeah. I
will probably do it around that time. Other people will forget about it, and I will not name names about those people, but I know that those people, they just, oh, shoot, I forgot that it got extended. Oh, wait, it got extended. Okay, good. And then they'll just never file it. And then other people will want to take every last drop of money from the government they possibly can, so they wait until the very last moment. Right?
Yeah. Yep.
And hopefully, because there's that variety, again, flattens the curve, because apparently that's what we're doing for everything.
For everything. Now, I guess the other thing I would say about, let's say delaying filing your taxes is right now, a lot of government offices are closed or working with like skeleton staff. And some of those people are working from home, but they don't quite have the same access from home as they did in the office. Like if you try and call a government office right now, you're probably waiting even longer than usual to talk to somebody because there's less people to answer the phone and more people making phone calls. So what do you think is going to happen when all those people do get back to work? It's going to be nuts is all I'm going to say.
Oh, yeah.
I can't even get through to my bank right now on the phone. I had to contact them on Twitter. And then I wasn't around, so they hung up, quote unquote, hung up on me on Twitter.
Twitter. It's amazing. It's how you're going to get hold of your financial institutions. Yeah. No, I can just see unnecessary calls and things like that, right? Like just flooding the system, right? Like we're putting bubbles around our children so that way they can't possibly go to the hospital.
Mm-hmm. Yep. Okay, I think that was the main things in the package. So again, it's not perfect, and it shouldn't be perfect, because if we were waiting for something to be perfect, it would take too long.
Right. The key thing is the speed. It's not perfection. We can armchair review it at a much later date, say, oh, they probably should have done this, or we probably should have done that. However, I will never say that they did the wrong thing. I'm just saying,
right,
this could have been done better.
Yeah.
You did good. It could have been done better.
Yeah.
Right? The fact that they did something is still still fantastic compared to just sitting on your hands and waiting for a better solution. Not even the best, just a better solution. No, you needed to act. And they all needed to act. And for the most part, I know personally for our realm, all levels of government have acted apparently.
Yeah.
Everyone's declaring state of emergencies.
Yeah, exactly.
Which, I wish they had a different name for it. Because
yes.
It's really not an emergency what they're doing.
Yeah.
Like, basically, it's a state of, I want to enact more powers for myself.
Yeah.
Which is good. Like, what they're doing with the powers is good, but still, that's all they're really doing. They're not saying, all right, bring in the military. No.
Yeah, that would be a state of emergency.
That's a real emergency.
Yeah.
What they're doing is saying, we need these extra powers, so we need to declare this to get these extra powers. Okay, so we're doing this.
Yeah. Well, I guess back in the 70s, it was called the War Measures Act.
Yeah, I guess it's better now.
Just watch me. Anyways, that's a little bit of the information in regards to the federal government's stimulus package. I'm sure there's going to be more to come. I think I mentioned it maybe off the record, but watching Trudeau's update, and one of the questions from the media was economists are saying that the deficit this year could be $100 billion, the largest deficit we'll have ever seen. What do you have to say about that? And it's like, what I would say is, if that happens, this is more of a temporary deficit than, say, the deficit that happened as a result of the Great Recession.
The only thing you can say poorly about this is the fact that he's been carrying a deficit, whereas if he hadn't been, we would be in much better shape. But that's neither here nor there now. Like, we're here now, so he's got to carry it, and I'm glad that he is.
Yeah.
Right? As a fiscally responsible conservative, or whatever you want to call me now, because apparently I'm not a conservative anymore, according to some people.
You're in the middle. You're somewhere in the middle.
Yeah, I'm just fiscally responsible and care about facts. I don't know, like, whatever that makes me. I can't.
So you're a liberservative.
Yeah, that'll be a good one. I wish that he hadn't spent the money, but he spent it, so let's move on.
Yeah.
Right? Like, he's going to have to carry a deficit. It's going to carry into our debt. Okay. This is what it's for.
Like, one of the things that, when I heard that question today, the thing that came to mind for me was, every single jurisdiction that's being affected by this thing is likely going to show a worse financial year than they did last year. If they don't, then either they were already super prepared for something like this to happen, or they're lying.
Or they directly benefit from it. Right? There are some things that are going to benefit from it. Like Charmin, like, they're printing gold at this point in time. But
I'm not talking about companies. I'm talking about governments. I'm just talking about governments.
Oh, okay. Government.
Yeah,
sorry,
no, that's fine. I mean, you're right. There's certain businesses that should probably show a great year because of the products that they sell and the products that people are hoarding. Like, obviously, if one of the things that Ford was talking about today during his press conference was, the manufacturing industry in Ontario needs to should convert to making medical supplies, because we do have a medical supply shortage in this province. And he's like, the province has a back order on N95 masks and surgical gloves and things like that. And it's like, we can't rely on filling those orders from the United States or from China or from wherever those products are coming from. We need a made in Ontario solution. And I think that makes sense. I mean, as it stands right now, let's say the auto plants, they're all shutting down. Well, maybe they can be converted to making masks or gloves or ventilators or whatever. Hopefully they can.
or some other similar business can. Like something, hopefully, some manufacturing business somewhere has the capacity to change. And it's good to see that Ford's not ordering it.
Yeah.
He's kind of nudging, like, come on, everyone's got to step up to the plate. Can somebody do this? And, you know, with him saying that, maybe they can work out a stimulus package for that company to offset that cost. Maybe, I don't know. It'd just be nice to see cooperation. And that's what he was looking for, which is weird to see him look for cooperation when he's like, I'm for Ontarians. Okay, Ford. Great.
But he does still call
Can
people...
you keep it up for the next... Sorry?
No, I was going to say, he still calls people folks, though.
Yeah, well, you know. We're all folks.
We're all folks.
Good folks.
Good folks. All right, sir. Let's cut this one off and move on to the next one.
Okay.
All right. This has been the, I guess technically second, but larger economic stimulus package from the federal government. My name's Adam.
My name's Mike.
We'll talk to you soon.